Suicide is the second leading cause of death for people ages 5 to 24 years old in the U.S. Now, new research suggests there were more deaths by suicide in young people than expected during the COVID-19 pandemic. Bradley Blackburn talked with a researcher about what this means for you and your kids.
Lockdowns and school shutdowns during the first year of the pandemic left many young people feeling depressed, anxious, and isolated. Now, new research in the journal Pediatrics finds youth suicide rates increased in 2020. More than 5,500 youth died by suicide, 79% were male, and 50% died by firearm.
That really highlights the need for safe storage of firearms in the home. If you're a parent and you own guns, storing them safely is paramount to reducing risk for suicide.
Dr. Jeff Bridge is the director of the Center for Suicide Prevention at Nationwide Children's Hospital. He authored the study that also found more suicides during the pandemic compared to before among non-Hispanic American, Indian, Alaskan Native youth and Black youth.
We really need to tailor our suicide prevention strategies through a culturally informed lens.
Researchers stress suicide is preventable if those interventions can get to the young people most in need, both at school and at home.
There are several school-based suicide prevention programs. It is okay to ask your child if they're thinking about suicide. That will not put the thought in your child's head. There is very strong evidence that refutes that notion. Have that conversation.
Dr. Bridge says we need to have those mental health conversations with our children because it is just as important as their physical health.
NC State University says a student died by suicide over the weekend. This is the third student death of the semester and the fifth suicide of the school year. The other two deaths this semester are believed to be from natural causes. In a letter to students, the university's chancellor wrote in part, "Whatever you're going through, we know we can get through it together. We are a pack, and our pack takes care of one another. Yes, we're a large community, but I firmly believe we're a caring one where each member matters. In short, you belong here." NC State already had a wellness day planned for Thursday. It's a day where students don't have class so they can take care of themselves. Chancellor Randy Woodson recommends students use the day to rest, recuperate, and check on themselves and others. Suicide is the second leading cause of death among Americans 15 to 24. Men are up to 6 times more likely to die by suicide. Triad mental health providers shared warning signs parents should keep in mind.
The smallest of details can be the most significant thing that can save someone. So everyone, please pay attention to yourselves, pay attention to the ones that you love and the ones that you are aware of, because that is the one thing that can make a difference.
You can sometimes assess just through phone calls. If they are closer, they're not across country at a college, but they are down the road at NC State, UNC, or App State, someplace drivable. Periodic visits, especially if they describe to you they're having some difficulties.
If you believe your child is struggling, you can help them by looking into local mental health care options. Collaborate with them to get them care. Remind them there are around-the-clock resources available. Governor Roy Cooper announced a $7.7 million investment in North Carolina college students' mental health. The funding will go to the UNC system for new mental health initiatives and to keep existing programs going. For anyone struggling, there's now only 3 digits they need to know: 988. Dr. Jonathan LaPook talked with a mom who believes this new nationwide crisis lifeline could have saved her teenage son's life.
This is 18-year-old Hunter Haskins, all-around athlete, college student, adored son.
He was smart, really smart.
His mother, Kelly, says 1 year ago she got a call from the Orange County Sheriff's Office in Florida.
They told me he had committed suicide, and that's when our world ended.
Her family saw no warning signs.
He died right after failing a math test. That broke our heart.
Good morning, 988. How can I help you?
Haskins believes the new nationwide 988 suicide and crisis lifeline could have saved Hunter's life. Unlike the 10-digit hotline number, 988 is easy to remember, the mental health equivalent of 911. The latest data shows call volume, including texts and chats, jumped 32% over the same month last year.
We know Americans are hurting, and now they're calling.
Secretary of Health and Human Services Javier Becerra says the Biden administration has directed more than $430 million to help fund state programs.
Are there some states that are weighing in a little bit more enthusiastically than others?
The federal government does not operate it. It requires every state to own 988.
Currently, only 5 states have permanent 988 funding. Haskins texted with a counselor to get a feel for what an interaction is like.
In the end, I was really happy with the conversation.
Now she is trying to get a 988 sticker on the laptop of every high school and college student.
Just trying to do something positive and trying to save a life. That's my goal.
If you or someone you know needs help, again, it's only a phone call away. All you have to do is dial 988 to be connected with a trained mental health professional.